Thank you ever so much. First of all, congratulations on putting this together, because it's not an easy topic, not least as we're not able to meet face to face. And I guess that's one of the key points I want to make, is how difficult it is to have conversations about racism, and how difficult it is for people to talk about it without feeling re-traumatized or victimized in the process. And I hope we can manage the conversations in the morning delicately and kindly, and come to a better understanding. We know racism is really pernicious. We know it's common. In fact, people are quite happy to say they're racist or prejudiced. They're more likely to tell you that than they are their age and income, usually, a lot of the time. And we know it's linked to poor mental health. There's lots and lots of evidence, both depression, anxiety, post-traumatic symptoms. And amongst the adverse childhood experiences that people have, it's not often talked about. And we know that the more adversity young people face, the more likely they are to have later mental health problems, physical problems also. And actually, if you have a lot of adverse childhood experiences, it also shortens your life expectancy. So this is really serious stuff. We know that racism, because it's not easy to talk about, is negated, neglected, omitted from conversations, and people don't talk about it. Therapists don't talk about it. Carers, service providers find it difficult. And interestingly, in our research, service providers of colour find it difficult to talk about, because they themselves are managing something in their own lives and situations. It leads to poor self-esteem. It leads to a fear. It's like a trauma. You know, you fear it recurring. You're constantly self-auditing. You're wondering what's going to happen. Each time you have an interaction with a police officer or a teacher or an adult or someone in authority, you have to worry about how the outcome is going to go for you. Are you going to have to think harder? So I started off my interest in thinking about how the ethnic inequalities in services were manifest, and why we had such high rates of schizophrenia and psychosis in Black populations, and why they were always coming to the attention of care services through the police or through the forensic system, through prisons, or in crisis on the Mental Health Act section. But I guess I've seen that that's just an amplification of what goes on more widely in society and in the population. And we need to think of racism as a public health problem and a societal problem that we need to challenge and remedy in order for young people to flourish in all aspects, in all spaces. So I'd like to make a plea for more research. There isn't a lot of research around, actually. Most of it's in the States and in Australia, interestingly. There's less in the UK. UK and Europe, to some extent, remain somewhat silent about it. And it's fantastic to see so much happening now, although sad to see it happening in the context of Black Lives Matter and COVID and the austerity measures and Brexit and all of these things that have taken place recently. The sorts of research that I think are really important, and it's important, this is ethical research, carefully managed research, is research that really explores the experience of people. What does racism feel like? And often it's not the egregious and the most horrible acts of violence. It's often the subtle, nuanced, everyday hassles, constantly thwarted aspirations, attempts to get a job, the number of times you have to fill out a form to get a job and you know that you're less likely to get it, the number of times you have to have a conversation with your teacher knowing you're going to come off worse from the conversation than not. So all of those things are really important. So it's really important for people who are in positions of authority, power and privilege to be able to acknowledge those difficulties in those conversations and actually try and unpack how they're so conditioned that they can't see the sources of inequality anymore. They can't do anything about it. They feel powerless. So we have to engage both those who are victims of racism, but those who perpetuate it, maybe not consciously, maybe they support a system that continues to lead to inequalities, but are unable to dismantle it. So research that really explores experiences, I think, keeps it real and reminds people of what's important and what matters and what's at stake. And of course, that should be linked to how we can co-design ways of preventing racism, how people can have better relationships across the racial and ethnic divides. We know race is meaningless as a biological entity. There's more variation in genetic material, for example, within any racial group than across, but it's a social variable. We classify people in terms of worth and value by the pigment in their skin, and it really needs to be challenged at every level. But it's exhausting, and that's the other element I want to mention before I finish, is that it's exhausting to do this sort of work. because you're constantly having to manage your own traumas and re-traumatization in conversations. And that's often not factored in. There are some people who think it's simply an intellectual object to tackle, but it's a very, very personal, deep-seated experience that people find very difficult to talk about because there are latent identities that get challenged and activated, and they fear histories of violence being enacted in the situation that they're talking about it. It's a terrifying process. So it needs a recognition of that. And certainly my experience in synergy in every piece of work I've done, and I wrote a book on racism and mental health 20 years ago now, is that it's much more exhausting than people think, and it takes a lot longer. I'm as impatient as anyone about this, but it does take time to fix these things. But it's important to have the courage to be well supported in finding solutions together and not to be alone in the process. Thank you very much.